we're going to go live, and you send the
All right.
apologies because of the.
See. So today we will be joined by Dr. John Nkengasong, and he'll be joining us in a few minutes because he's still wrapping up a presentation that he's making to the ambassadors who make the Permanent Representatives Committee. So it's only a few minutes, so we kindly ask for your patience as we wait for him to join us. But in the meantime, I can also state that we are very happy to be joined by Mr. Ralph Mupita. And Mr. Mupita is the Chief Executive Officer of the MTN Group. And his role today will be to provide us with details on the One More Push initiative. I'm sure you will recall that Dr. John mentioned this last week, and he also recalled that support that came from MTN about the vaccinations that were procured for about 7 million people, I think, mostly in the health sector. And that was a big issue that we talked about last year. And so that partnership and that collaboration with MTN continues. So you will be hearing directly from the Chief Executive Officer of MTN, Mr. Ralph Mupita. And I can also say that he is already with us. So we will be crossing over to him once we start the briefing. We are also expecting to be joined by Mr. Osagi Ehanire. Now, Mr. Ehanire is the Minister of Health of the Federal Republic of Nigeria, and he will be here to give us an update on the COVID-19 situation in Nigeria. You will also recall that last year we started a program where we were bringing in member states to really talk about the situations in their individual countries. And so today it is the turn of Nigeria, and the Minister of Health himself will be here with us. Now, because we have those two very important guests with us, plus the briefing that is going to come from Dr. John, it means that the time that we will have for our question and answer section will be limited today. So we are expecting it to be limited to about 23 or 25 minutes at the most. So I would urge you, colleagues, if you have questions that you want to put through to any of the three panelists today, that you start writing them in early so that we can have as many as possible during the time that is allocated to us. And then for those who might not be catching the sound properly on whatever channel you are catching us on, I want also to say that we are coming through both on the Zoom and other platforms. And these would be the live stream of the African Union, which you can get from the website of the African Union at www.au.int. And also you can get this broadcast from Facebook, both the African Union corporate Facebook channel, as well as the channel of the Africa Centers for Disease Control and Prevention, as well as from the Twitter handles of both the African Union and the Africa CDC. So like I've said, we are just on standby waiting for Dr. John. If you can just give us a few minutes, I'm sure he'll be joining us very soon. He's unavoidably held up as he was briefing the PRC, specifically on the issue of vaccines, which, as you know, is the most topical issue on the continent right now. So please stay with us. We'll be with you very shortly. Thank you, colleagues. I'm seeing that you've started to send in your questions. Because of the limited time that we'll have for our question and answer section, I'd like to ask you please to prioritize your most important question so that in case we don't have enough time to take all the questions, we can take the one that is most important to you at this point. But thank you very much. I'm seeing that the questions are coming in, and I'm seeing a hand that is raised. Good morning, Gabrielle. Good morning, George. Good morning, Coletta. We are just, I'm sure, a few minutes away. All right, I see that Dr. John has joined us and he is on standby. Dr. John, good morning. I had already introduced. I had already introduced you and passed on the apologies for the slight delay, but you have the floor now. Please go ahead with your briefing.
No, thank you, Wayne. Let me join my sincere apologies to yours already and just say that to the colleagues on the platform that this is really completely out of our hands. I mean, the severity of the third wave required prompted our permanent representative council of the AU to summon to convene a special session, which of course, as can imagine, has to do with 55 ambassadors, and everybody is extremely concerned and worried. And I mean, the discussion could have lasted for more than 3 hours in terms of everything that they have to discuss on the table, including the vaccination issues that we shall be discussing. So my apology for the about 10 minutes lateness. So a very good morning and greetings to you all from Addis Ababa, from the Africa CDC. As always, I would give you an update on the epidemiological situation and then discuss what we are doing to support member states and then the vaccination situation. As of this morning, July 8th at 9 a.m., a total of 5.7 million COVID cases have been reported across the continent. And the number of deaths as of today stands at 148,000, with a case fatality rate of about 2.6%. The following countries, 5 countries, are accounting for 64% of the case loads. South Africa with 37%, translated to 2 million, above 2 million cases. Morocco, 9% of total cases, translated to about 530,000 cases. Tunisia, 8%, representing 464,000 cases. Egypt and Ethiopia, both at 5%, about 280,000 cases each. So in terms of the variants, we continue to see a continent that is reporting more of these variants. 58% of our member states, or 32 countries, are now reporting the Alpha variant, originally identified in the UK. And 53% of the member states, or 29 of them, are now reporting the Beta variant, originally reported in South Africa. 15 member states, or 27% of our member states, are now reporting the Delta variant, which was originally reported in India. And since the last briefing, 2 additional member states, Algeria and Rwanda, are now reporting that variant. Let us now transition to the trends, the epidemiological situation 1 week, over the last 1 week, and then we'll also discuss the trend over the last 4 weeks. If we compare the week of the 25th epidemiological week, which is the week spanning between the 21st and 27th of June, and then this week, which is spanning between the 28th of June to 4th of July, we notice the following trends. A total of 254,000 cases have been reported on the continent, representing a 22% average increase compared to last week. The highest proportion of new cases, again, is from Southern Africa, representing 71% of the cases. The following 5 countries are reporting the highest number of new cases: South Africa, Tunisia, Zambia, Namibia, and Zimbabwe. A total of 5,000 197 new deaths have been recorded since the last briefing, and this represents a remarkable increase of 43% when you compare the number of deaths last week and this week. If we now look at the 4 weeks epidemiological trend, as a continent, we've recorded about 28% average increase in number of new cases over the last 4 weeks. And the following are regional breakdown: 40% average increase in Southern Africa, 22% average increase in Northern Africa, 18% average increase in West Africa. 2 regions are reporting a decrease, 7%. Actually, 1 region, Central Africa, is recording a 19% average decrease, and Eastern Africa is 7% increase. So 4 regions are showing a steady upward increase, and 1 region a decrease. In terms of new deaths, over the last 4 weeks, the continent has recorded a 28% average increase in new deaths. If you look at the 5 most populous countries, include 39% average increase in South Africa, 24% average increase in the Democratic Republic of Congo, 23% average increase in Kenya. However, 3 countries are recorded steady decreases in death. It include Ethiopia, Egypt, and Nigeria. In terms of testing, as of today, the continent has conducted a total of 54,174,000 tests, and this represents an increase of 1.3 million new tests compared to last week, and that is about a 2% average increase. Again, the formula for us to win this pandemic is to increase testing, and as we've said before, if you do not test, you don't find. The overall case positivity rate still remains high, around 10%, and the test per case ratio is 9.4%. This week, the following countries, 13 African countries, which is about 24% of our member states, reported test positivity rates that were higher than 10%. 42% of our countries, that is 23 countries, are now reporting the third wave. And 13 of those countries, that is 13 of the 23 countries, are reporting a more severe third wave. Since the last briefing, 2 additional member states are now experiencing the third wave, that is Malawi and Senegal. And as we indicated last week, Tunisia is going through the fourth wave. So let me now discuss or conclude by discussing the vaccine situation on the continent. As of July the 5th, a total of 70.4 million COVID-19 vaccine doses have been reported or procured by 52 member states on the continent. The total doses consumed so far is 53.3 million, and it represents about 75% of total doses that have been consumed of the about 70 million doses. If we now look at those people that have received full immunization, that is their 2 doses coverage, then our percentage coverage stands at 1.19% of the top population, which is too low for us at this point in the pandemic. Some countries are making very remarkable progress, like Tunisia has used up Morocco has used up about 98% of all its vaccines and vaccinated about 24% of its population. Egypt has used up about 60% of all its vaccines. Nigeria has used up 99% of its vaccines. South Africa about 42%, and Algeria about 68%. As of July 1, Johnson & Johnson announced data that demonstrated that a single dose, that is the Johnson & Johnson vaccine, had very good activity against the Delta variant, which is very good news. as a lot of our countries in the coming weeks will be receiving vaccines, mainly the Johnson & Johnson. On June the 5th, Morocco pharmaceutical firm Sotema will announce that they will soon producing 5 million doses of the vaccines per month, and this will be essentially the China's Sinopharm vaccine. COVAX delivered again 1.3 million doses of Pfizer to South Africa, and COVAX via the French donation delivered 228,000 doses of the AstraZeneca to Zambia. And today, Kenya will be receiving about 1.2 doses of the AstraZeneca vaccine and about 408 doses of the same vaccine for Somalia. And just to conclude, colleagues, today the MTN, that is the mobile telecom company in South Africa, and Africa CDC will jointly launch the One More Push initiative. The One More Push initiative is really focused on continuing to encourage all of us, all of the population, to wear masks. We know that masks for now, in quote unquote, is our best vaccines. And we have to continue to use public health measures to make sure we fight this pandemic. This partnership with the MTN is really a partnership that aims to support our continental joint strategy, which we reported and endorsed on the 8th of May by the Ministers of Health, which focuses on enhanced prevention, enhanced monitoring, and enhanced treatment. So I think I'm very pleased that we will devote a good part of this conversation to that initiative. It is also a natural progression that the MTN is supporting this because, as you recall, they were one of the first private sector partners to allocate $25 million to supporting the efforts of the Africa CDC and the African Union to roll out vaccines to supporting our healthcare workers. Thank you, Winnie, and I will turn it back to you so that you can coordinate the rest of the session.
Thank you very much, John. And you have already introduced the concept behind our partnership with the MTN group. So colleagues, for now, my job is simply to introduce the Chief Executive Officer of the MTN group, and he is Mr. Ralph Mupita. And in the next 10 minutes, Mr. Mupita will be giving us the details of that One More Push initiative that Dr. John has referred to. So Mr. Mupita, you're welcome and you have the floor.
Win, thanks very much. And Dr. John, good to see you. Good to see you again.
Please go ahead with your brief. Please go ahead with your brief.
Okay, thank you so much.
No, good. Thank you so much for Ralph for joining. I think it's good, very good to see you, and my sincere appreciation on behalf of Africa CDC to the MTN leadership and of course yourself for the really being the early pioneers in supporting the Partnership for Africa to really fight this pandemic with respect to the donation that you made for vaccine, accelerated vaccine access for healthcare workers. Thank you.
Dr. John, thank you so much. And to everybody else joining into this media briefing, just a couple of comments from the MTN group. I guess it goes without saying that from an MTN perspective, we have the position and the perspective that says that what is good for Africa would be good for MTN. We're operating in 21 markets, 17 of those on the African continent. So pretty much 1 in 3 of the markets under the AU, we have an operation there. We have intentions, obviously, over time to expand our market presence, but we do feel very closely tied to the fortunes as well as the challenges that the African continent faces. So maybe to begin with my comments, 18 months ago when COVID-19 really started to proliferate more across the markets, we took a position as MTN that we would do what was in our powers and within our resources to support any campaigns that would be positioned to stop the spread of COVID-19. COVID-19 has had tremendous and significant impacts on lives and livelihood of Africans. And as we see, over the last 18 months, it is very clear, and the data is clear globally, that the right way to get out of the challenges we face is vaccination. And beyond vaccination, to get to herd immunity. And without getting to herd immunity in Africa and across the world, we cannot get back to some sense of the new normal. So we did, at the second half of last year, actually start with a mask wearing campaign. We called that mask wearing campaign, Wear It For Me. And it was focused on ensuring or encouraging our brothers and sisters, mothers and fathers, broad spectrum, to follow the preventative measures because vaccines were then not available. And obviously mask wearing was one of those measures. So we did push quite strongly through our regions and encourage through marketing efforts, whether it's through the media, via advertisements, on TV, on billboards. We pushed quite strongly the Wear It For Me campaign. And Dr. John, as you've mentioned, our second efforts have really been around the donations and the opportunity to work with the African Union CDC and the Africa Vaccination Acquisition Task Force led by Mr. Strive Masiwa, where we did make our contribution of $25 million for procuring on an urgent basis vaccines to support frontline workers, specifically health workers. And we are in progress with that initiative. It's taken a bit more time than we thought it would take. And I think the complexities of vaccine acquisitions through COVAX and other platforms has obviously been very difficult, particularly for the African continent, where we have less than, and the good doctor would know this, obviously less than 3% of Africans anywhere close to receiving even a first dose. So we're far, far away from the prospects of herd immunity. And with that as a background, we did have the discussion with the African Union CDC to then say, in the context of us firmly believing that vaccination is the way to go and putting our money where our mouth is with the $25 million, we said another initiative is needed. And that initiative has been this campaign that we're talking about, the One More Push. And Doctor, as you've mentioned, we are in the throes of the third wave in many of our African countries. The Delta variant being very significant and causing infections and deaths aligned to the statistics Dr. John Kengasong has shared. So we felt that we needed to go back to the basics and aligning ourselves to the enhanced preventative measures that the AU CDC has set out. And one of those obviously is mask wearing. So we are picking up on the mask wearing initiatives and across our markets, and obviously also using the various media platforms, international media platforms. We are, for the next couple of weeks, going to be committing a lot of our marketing resource to pushing the messages out in whatever form, radio, on TV, on billboards, etc., and using digital platforms as well to encourage all Africans, particularly those who have not yet been vaccinated, to wear masks. And not to wear masks in terms of just protecting themselves, but protecting their loved ones. And so this campaign, obviously supported and endorsed by the Africa CDC, will be launched on a Pan-African basis pretty much today. And we're very excited, Dr. John Kengasong, to be again partnering with you. We believe that public-private partnerships of the sort are going to increasingly be needed going forward to resolve many of the challenges that our African continent faces. There's tremendous potential within our continent, and part of unlocking that potential is making sure that we have a healthy population and we deal with the ravages and the issues that COVID-19 has presented. We remain optimistic that we'll get there, that we are going to one day be looking at a situation where we've reached herd immunity, Dr. John Kengasong. But in the meantime, the enhanced preventative measures such as mask wearing become super important. And we're very proud to be associated with the Africa CDC, which is playing a very pivotal role in Africa's progress. And we just want to thank you, Dr. John Kengasong, and the CDC for the work that you're doing. So these are my comments, and I just want to hand back over to you.
Thank you very much. That was the briefing from Mr. Ralph Mupita, the CEO of the MTN Group, and he has reiterated there the very commendable corporate responsibility that MTN is carrying out in terms of promotion of public health measures, in this case focusing on mask wearing, but he has also given us a roundup of some of the donations that they've made to this campaign to fight against COVID-19. Okay, colleagues, it looks like the minister that we were expecting is still trying to connect. So we will then delve straight into our question and answer section. And as I stated at the beginning, we have quite a number of questions. So I will be taking just the first question among those who have asked a number of questions. And perhaps if we have time, then we'll come back for the second round. So the very first person to send in a question today is George Obulutsa, and George is with Reuters news agency. And he says, for Dr. Nkengasong, is Africa CDC aware of the Delta variant in Nigeria? Please also give us an update on the spread of the Delta variant in Africa, including where it has been detected and whether it appears to be driving up infections and or death rates. So that's from George Obulutsa of Reuters News. Dr. John.
Thank you. I think I can, excuse me, I can definitely be as specific as you want with respect to where the Delta variant has been reported in Africa. As I indicated in the overall briefing, there are a series of countries that have reported that. We could give you the names of those shortly. I would just ask that my colleagues bring back the listings. It's a listing of a whole list of countries that they bring in the list, and I promise you that I will read you the list of all the countries that have reported the Delta variant. With respect to, is this variant driving the pandemic? Of course, yes. If you look at DRC and Uganda and others, you clearly see that the variant over time is becoming a dominant strain in several of these countries that they are present there. So I think it is known that this variant transmits in excess of other compared to other variants, and then that we should be actually keeping an eye on this. And just last week in Nigeria, between the 4th and between the 14th of June and the 2nd of July, we brought member states together to train them. Many countries together to train them and arm them with the ability to sequence locally. So again, I will give you, promise you that by the end of this session, I'll give you the names of those countries with that have reported the Delta variant.
Thank you very much, John. Thank you very much, John. Thank you very much, John, for that response. We move on now to welcome Gabrielle Steinhauser from the Wall Street Journal. Gabrielle, please go ahead with your question, and good morning.
Good morning. Thanks so much. I'm following up on my question last week, if you have the findings yet of this mission that you sent to the Seychelles, including on how prominent Delta is there, which I don't think we really know much about, but primarily you were looking, I think, into the vaccine efficacy.
Exactly. Yeah, exactly. Thank you, Gabriel, for bringing back that question. I did promise you that I will give you some information as we speak. The team is just back, and on the 24th of June, at the debriefing, Dr. Jude Gideon, the Seychelles Public Health Commissioner, announced that they were reporting the presence of several variants of concern that was the Alpha, Beta, and Delta variant, all in the country, with a predominance of the Beta in the country, highlighting the need to further expand testing and implement genomic sequencing there. They also underscored the country's continued efforts to mobilize resources and engage with the community. Clearly, what the early findings that we are seeing, and again, just put this in the context of that analysis is still going on. Our team spent 2 weeks in Seychelles and was subsequently joined by the WHO team. That the full analysis is still going on, but what has emerged very early on is that when they didn't know about these variants, that all these other variants were now they were at that time circulating in the country. So I think it's safe to say that the surge we saw in the transmission there was because of these new variants that had been introduced there, and also because of the eagerness and the need for the country to balance between saving lives and saving economies, given that that country relies a lot on tourism for its survival. So at the ease, the lockdown, I think it became very clear that they were seeing a rapid introduction of new variants into the countries, i.e. the Alpha, the Beta, and the Delta variant. So that's what I can say for now. We'll wait again until our team finish doing the analysis with the government of Seychelles. Then we'll give you with accuracy what the data says at more clinical level. But again, take it that the variants have been playing a role in the upsurge of this in that country. So I think I think that's all I can say for now.
Thank you very much, John. Now we move to our WhatsApp platform, and we have a question coming in from Kara Anna, who is with Associated Press. And Kara says, which countries are starting to receive the US-supported Pfizer and Johnson & Johnson vaccines this week? And how many doses are going to each country? That would be for Dr. John.
As you can imagine, the list has been established. We've sent out note verbals to all member states. Note verbals are the usual channel of communication to member states. And starting this weekend, the countries will begin to receive their doses from COVAX facility. I cannot, because I've not been on seat since morning. I've been in briefings since morning, so I have not followed up with Geneva COVAX to see exactly which of these countries will be receiving vaccines this weekend. But that was, as of yesterday, the understanding from COVAX through the different meetings and exchanges that we've had. So I cannot give you off head now the distribution per country for the 15 million doses there, but be assured that countries have been communicated. I was on the call yesterday with the Minister of Health of Sierra Leone, and they confirmed that COVAX has already engaged them and informed them that they're receiving about 113,000 Pfizer vaccines. So I can imagine that all countries have been notified directly from COVAX with the specifics of which vaccines they will be receiving.
Thank you, John. We go back online and say hello to Gabriel Baglo. Gabriel, good morning. Just introduce your organization and ask your one question, please.
Hello.
Good morning. Hello, Gabriel, we can hear you. Please just introduce your organization and ask your one question.
Yes, the Congress of African Journalists. My question is, a number of people are now feeling the shortage of the lack of vaccines. So reports from Senegal say that since last Monday, citizens or people who went to take their second jab were told to hold on. So the question is to know what will be the consequence if you have not taken the jab for some time. So do you still have your first jab working, or in case the delay should take too long, what will be the consequences and what should be the solutions to that? So there's a lot of anxiety presently that the shortage, especially of AstraZeneca and the COVAX vaccines. So what will be the solution and what will be the consequences of that shortage? Thank you.
So that's a very good, that is a very good question. Clearly, the situation in Senegal is not unique in Senegal. You see that for the past couple of months, countries have not received a steady supply of vaccines from the COVAX mechanism. So that is hurting the ability to predict when and how people will approach the vaccination centers. But as I indicated during this briefing, help is on its way. We will be 15 million doses of those vaccines from the US donation will start rolling out soon. I also wanted to highlight that the first 7 million doses of vaccines from the AVAX supply, the Johnson & Johnson, will also start rolling out next week. So I think that is from South Africa. That is very good. That signifies early delivery than the August timeline. So I say this to say that there's for those who have received AstraZeneca and have the option of receiving the Johnson & Johnson and even the Pfizer, they should still receive it, because we now have evidence and science based on studies that by combining or mixing those vaccines, and in some cases that the immunologic reaction is even very profound when you use AstraZeneca and then you use a different vaccine like the Pfizer or Moderna. So I think, yes, the situation is very worrying. We remain positive that with the new arrival of vaccines, countries can adjust their strategies.
Okay, thank you. Thank you.
Thank you very much, John, and thank you, Gabriel. The next question that we had coming in is from South Africa, and someone called Brian Tucker, and he says, if technology exists to create micro robots that fit into needles, and if it is possible to edit human DNA, does Africa have the technological capacity to reverse engineer materials to see if there are no micro robots in the vaccines? And if yes, can these results be published and someone take a responsibility for them? That's for you, Dr. John.
No, thank you. I mean, I don't, my short answer to that is that I've not looked into that particular area of work. And I've not seen any research yet in that particular area of work. So there's not much I can share with you there. So I promised that to our colleague from Reuters that I was going to give you a list of those countries that have reported the Delta variant. They include, there are 15 countries that have reported the Delta variant. It's Algeria, Botswana, DRC, Gambia, Ghana, Kenya, Malawi, Mauritius, Morocco, Nigeria, Rwanda, South Africa, Uganda, Zambia, and Zimbabwe. So a total of 15 countries.
All right, thank you. It's time to bring in Sophie Mukwena, who is calling us live from the South African Broadcasting Corporation. Good morning, Sophie. Please go ahead with your question.
Thank you so much. My first question is directed to Dr. Kengasong. Dr. Kengasong, we've seen numbers rising in South Africa. It looks like we are not going to see numbers going down anytime soon. Is the Delta variant the cause of numbers rising? And then to MTN, I want to find out, in most cases, the multinational companies, when they embark on campaigns and they use media to communicate the message, they tend to look at broadcasters and media agencies from abroad and ignore the broadcasters and media companies on the continent. Are you going to invest in the broadcasters that are operating from the African continent and that have strong footprint on the continent? or you gonna look at international broadcasters and international media agencies?
Thank you very much, Sophie. Let's start with Dr. John.
So, Sophie, good question there. Yes, we are seeing an increase in the Delta variant in South Africa based on data generated from South Africa. So it's clearly, as was the case with when we reported, when South Africa reported the B135 variant, that is contributing in the spread of this pandemic in South Africa. But I really want all of us to be on the same page with this, that regardless of these variants, the public health measures that we know work against all these variants. Okay, that is gathering, mass gathering, wearing of masks, washing of hands, and avoiding large clustering indoor. They all work against these variants, I mean, for sure. So in other words, we don't have evidence that we don't have evidence that these variants maybe transmit through other means, like through the skin or the eyes or the ears. No, they don't do that. So we just have to keep implementing those public health measures rigorously to blunt the rise of these new variants. The second thing I like to say is that we shall overcome this. And South Africa has done this before. This is the third time South Africa will be bending the curve nicely. If I had slides here, I'll show you how the first wave was, how it came down, then it went up, and then down. So we shall overcome, and we have to overcome. As a continent, we have fought a good fight, and to keep maintaining the virus where it is. It was known and it was predictable that we cannot win the battle against this terrible virus with only public health measures. The challenge we have so far is because of the delayed introduction of vaccines on the continent. A continent of 1.2 billion people with only 1.19% of its population fully vaccinated cannot in any way, doesn't have a chance of blunting these waves coming on and on. Would there be another wave or a fourth wave? I want to assure the continent that it will be. Okay, Tunisia is already going through a fourth wave, as I reported, and unless and until we roll out vaccines at scale and at speed, we'll continue to see this. But I believe strongly in the resilience that I've seen across the continent for the past 18 months. South Africa being one of the champions, and others that have really taken measures in a timely manner to most of the time take courage, and because it's not easy to implement some of those lockdowns and restrictions. There are people, we must admit there's pandemic fatigue out there, but we know the consequences of not applying those measures. So again, Sophie, the variants are out there, but the public health measures work perfectly well against these variants. The Johnson & Johnson vaccine, which we've seen studies that are saying that they work perfectly well against this variant. So let's just make sure that we adhere to the kind of efforts that we are discussing today with Raf on let's wear your mask, let's wear it proper, let's wear it in a sustained way, and really change it as frequently as possible. Let our government supplement the population so that they can actually afford the mask. We cannot underestimate the challenge that a common person may have in just wearing a mask and changing it as frequently as is required, so that we can, while waiting for vaccine rollout, that I know will start in the month of August in a very systematic and predictable manner in Africa, keep blunting the spread of this. That is the importance of this initiative that we are here to launch with our colleagues from MTN.
Thank you very much, Dr. John. Now we go over to Mr. Mopita for that question on whether you will be utilizing reputable and continental African media in the campaign. Over to you.
Yes, thanks very much, Sophie, for your question. I mean, obviously, the objective of our campaign, One More Push, is to bring the message, to the very local level. And to do that, Sophie, you can well imagine that it's very, very important that we use local, in-country, and regional media platforms. So in short, our focus would be to use, local. We are operating, as I mentioned, in 17 African countries. So those campaigns will be run in our markets, and using the agencies, the platforms, the media that is local. We will as well have, kind of over the markets campaign, particularly where we don't have our own operations. 2/3 of the African continent or African countries, we don't operate there or have telecommunications operations. So to get the message there, we would use the media platforms that are much more pan-African. But the bulk of our marketing resource, our financial resource to drive the campaign will be very local. Thank you very much for the question.
Thank you very much, Mr. Mupita, the Chief Executive Officer of the MTN Group. We move on to Coletta Wanjohi, who is with FSN. And Coletta says, Dr. John, the United Kingdom has announced that it is ready to offer some countries in Africa genomic sequencing support through the new variant assessment platform program. How timely and or how vital is this? And she also wanted comment on the Nigerian situation. So that's from Coletta.
No, thank you, Coletta. We welcome the initiative from the UK government to support variant analysis on the continent. As you recall, Coletta, we as Africa CDC already have a pathogen genomic network that has been supporting countries in a network manner where we have specialized labs, regional labs or centers, and then national labs there. Through that network, we have been able to generate or support more than 19,000 genomes, move about 13,000 samples around the continent. That is moving it from countries that cannot sequence to countries that can sequence and moving back the data. Just last week, between June the 14th and July 2nd, we had a very large workshop in Nigeria where we were training so many African lab experts on genomic analysis. So the UK initiative is very much welcome. I think we stand here as Africa CDC ready to coordinate with everybody, because the importance of pathogen genomics is not just doing the analysis, but is doing that quickly and sharing the information, not just within the country, but across the continent through the networks that we have established. So we have that. I don't the Nigeria situation that you raised, I don't know what it's about. I don't have further information in Nigeria with respect to the situation of the Delta variant in Nigeria.
Thank you very much, Dr. John. I think Coletta was expecting the minister to be here, but thank you very much for attending to that issue regarding Nigeria. So the next person we have online is Hilary Orinde from the news agency Agence France Presse. And he is asking a question that you discussed last week, but I wonder if there is a change. So he's saying, a quick follow-up from last week to Dr. Nkengasong. What does the Africa CDC have to say of Uganda's purported COVID herbal remedy called Covidex? Do you support its use?
Thank you so much. I think let me discuss that from a principle perspective. I think our principles and policy is clear that all remedy should go through the appropriate clinical trials so that we know exactly three things. One, we know the safety of that remedy. Second, we know the efficacy of that remedy. And thirdly, we know issues of standardization there. So I think that is clear. Those are the principles that govern our approach to any remedy that is claimed. Very importantly, we are not excluding anything from the table, okay? Because we just don't know where the solution to fight this pandemic will come from. So it might come from African remedies. I think that so many people on the continent do count on traditional remedies for that. But all we are asking is that it should be backed with science. Okay, with clinical trials there. So that's all I can say with respect to the remedy in Uganda. It's the same position we took when there was a lot of discussion last year concerning the remedy from Madagascar.
Thank you very much for that. We now go over to Judith Akolo, who is with the Kenya Broadcasting Corporation. And so Judith says, my question is, considering that it was quite clear in last week's briefing that the European Union is not allowing Africa to procure COVID-19 vaccines from their producers, has anything changed since then? And have the EU member states begun allowing Africa to procure vaccines?
No, nothing has changed since last week.
All right, thank you. Let's say good morning to Bonisile Makubu from the Times of Swaziland. Bonisile says, apart from the scarcity of vaccines and also vaccine hesitancy, what other factors are frustrating the timely and quick vaccination processes in African countries?
In African countries, there's two major challenges that we face. One is having the vaccines, and then second is having the support facilities to roll out the vaccines, and which include preparing the community, setting up vaccination centers, and also making sure that those vaccination centers do have the vaccination commodities. And I think those are, now countries, when we talk of the predictability of vaccines to a country, why is that important? It is important because it will enable a country to prepare. Okay, you have to prepare knowing which vaccine is coming. You have to prepare knowing the time of the vaccine and the frequency of the vaccines. So that is why it's so important that we work closely with countries to support them and enable them to predict when vaccines will come and when they will roll it out. There's also vaccine hesitancy, which is, again, it's not a static process. We see that in certain countries, and then with for campaign awareness, we see that the uptake improves over time. So I think once people start seeing that their loved ones have received a vaccine and they are doing well with the vaccine, they will take vaccines. And once they know exactly where to go get a vaccine, they will take a vaccine. So I'm not so much worried with are there pockets of resistance or that will continue? Of course, yes. As a human population, our behaviors are very different. But is the majority in that space where they will continue to resist vaccines? I don't think so. I just gave you some numbers that during the briefing, which I said about 75% of vaccines that are available on the continent have been used. So again, if the vaccines are available in a predictable way, I'm very convinced that the rollout will be, the population will cooperate because they know that it saves lives and it saves their loved ones.
Thank you for that. We go back to the questions from George Obulutsa, who is with Reuters news agency. So he says Senegal is witnessing what is likely going to be a third wave, and officials, including the president, are quite worried. They are counting on vaccines, but the country is out of supplies again. The AstraZeneca shots that they received as a donation from France have all been taken up. Are they likely to get any help? And he notes that Ghana seems to be in a similar position, and concludes by asking how many countries have run out of vaccines and when will they be getting fresh supplies?
So I think many countries, unfortunately, are in that situation where they were expecting doses from the COVAX mechanism. And however, as I indicated today during the briefing, I think I listed a certain number of countries that will be receiving their vaccines, some of the vaccines down the road through COVAX. I mentioned South Africa that is gearing up to receive 1.3 million doses of Pfizer from COVAX, and that France, through a donation from France, the AstraZeneca vaccine will be arriving in Zambia, about 228,000 doses, and Kenya and Somali. And I've also mentioned that the United States donation of 50 million will start, distribution will actually start this week going forward. And those countries that bought their vaccines through the AVAT mechanism will also begin to receive their vaccines come next week. So that's all I can say. I don't have a comprehensive list of who has vaccines and who doesn't now on the continent. All I know is that most countries that have received their vaccines have used them appropriately. And there are a few countries that may be struggling to use their vaccines before the August shelf life. And we are doing everything possible to support them to roll out those vaccines.
Thank you very much. We have a question coming in from Notolo Kampi. Now, Notolo doesn't state her news organization, but she has a very different kind of question. So I'm going to put it to you. So the question is, to implement the One More Push campaign, have you considered getting volunteers to help out? And if so, how can people assist, particularly the youth? And so I'll throw this one to the MTN Chief Executive Officer.
Thank you very much for that question. I mean, we haven't actually thought about the volunteer aspect, but I think it's a very good suggestion. We'll take it all in and take it back to the team about how do we integrate it to make the campaign more pervasive and actually, have a lot more impact. So thank you for your suggestion. Now, I know my team are listening in into this briefing, so we'll for sure consider that. Thank you so much.
All right, thank you, Mr. Mupita. We go back to Judith Akolo, who is with Kenya Broadcasting Corporation, and this is for Dr. John. My question is, at the beginning of these briefings, we had the European Union Commissioner for Crisis Management, Janez Lenarčič, promising to ensure that Africa is able to access COVID-19 vaccines. Would I be right to say that the EU has abandoned the plan?
I would not characterize it as abandoning the plan. The EU has been supporting the COVAX mechanism for sure. I mean, several EU member states are really very supportive and are the backbone of COVAX. So the intent has been there to support Africa through the COVAX mechanism. And I believe that that is where the commissioner's pronouncements came from. However, we know that that mechanism, because of the situation in India, has not followed through with the delivery of vaccines on the continent, which is very, very unfortunate. I think we said earlier, and I believe I was one of those to warn that the situation in India was making it extremely complicated for our vaccination program on the continent. On that note, I have just yesterday written a note verbal to the ambassador of India in Ethiopia, the ambassador to the AU, that is the India's ambassador to the AU, that we meet urgently to discuss the situation because it's absolutely impacting on our continent's ability to vaccinate. I mean, we need to review where we are with that situation and see where we can find common grounds. And think we continue to be relentless in engaging whoever we can engage to secure vaccines for the continent. So the commissioner, I believe at that time, was referring to the European support to COVAX. But unfortunately, the situation in India is what it is. And regrettably, it has affected significantly our ability to vaccinate on the continent.
Thank you very much, John. I think we have about 5 minutes to go, given the extra 10 minutes that we were given by the producer. Mr. Mupita, in about 30 seconds, there's a question coming from Della Russell saying, how much is MTN committing to the One More Push initiative and how long will the program last?
Thank you for the question. We haven't put in a financial amount because it's coming from our kind of normal marketing budget, but we're making sure that it is firstly across our footprint, so at least 17 African markets. The second point, as I made in the original question from Sophie, we will have a kind of over the top the markets where we don't operate using regional media so that the messages ultimately get to as many people in the 55 member states of the AU, and want to run it on a sustained basis, at least through this third/fourth wave. And if there is a need to prolong it, we can make that decision. So, we haven't explicitly, put out a financial amount. The only financial amount that we've put out in terms of our support for fighting COVID has been really around securing doses for healthcare workers, which was the $25 million. Thank you.
Thank you very much, Mr. Mupita. It's now time for us to give those summary briefings, highlighting the main points from each of our panelists. And I will start with the MTN Chief Executive Officer, Mr. Mupita. In about a minute, please, can you just round up and give us a summary of the main points that you want our colleagues to take away from the briefing today?
No, thank you very much. I'd say the main messages are in the following few points. The first is, as MTN, we stand behind the African Union and the Africa CDC in its fight against COVID. And as part of that, we are leaning into the enhanced preventative measures, and in particular, this mask-wearing campaign. The second point is that we believe private-public partnerships such as this are much more needed, and we would like to encourage other corporates to support and work with the Africa CDC in its efforts to eradicate the scourge of COVID-19. We will get through this, but we have to get through this all together. And the final message is really this point about the one more push. Please put your masks on, not for yourselves only, but for your loved ones and even the people around you. We have to do this if we're ultimately to get to herd immunity. Thank you very much.
Thank you. We move to Dr. John for your final closing remarks.
Hello, can you hear me, Wayne?
I can hear you very well. Please go ahead.
Okay, good. I think that, first of all, let me acknowledge the very strong partnership that exists between the Africa CDC and the MTN group. As Ralph mentioned, this is the second major partnership that we are engaged in. And it speaks to the spirit of what I call a new public health order for the continent, that we will not solve our public health challenges only with the government engagement, that the private sector has to be engaged. If you all have heard me talk about and written about a new public health order for the continent, we've argued for at least four major things. One, that the continent has to take a leadership role in vaccine manufacturing. And I'm very pleased that we are seeing progress in that direction. South Africa, you heard 2 weeks ago the announcement that we'll be launching into vaccine manufacturing. We now heard that Morocco is joining, Algeria, Egypt, and I think, those that are really at an advanced stage for manufacturing there. The second thing that we talk about, a public health order, is strengthening our national public health institutes. And the third thing is workforce, and then the fourth is partnership with the private sector. So I'm very pleased that we're here today to launch this very critical initiative, which aligns with our own continental adapted strategy, which we all agreed at an emergency meeting of all ministers of health on the 8th of May, which we said we should actually promote enhanced prevention, enhanced monitoring, and enhanced treatment. That is extremely important. My second and perhaps most important message today is that the continent is in the middle of a serious crisis, a serious COVID crisis, where so many countries are witnessing a severe third wave, a very severe and brutal third wave. But I really want to echo what Ralph said, that we have to win this battle. We have to be resilient. We have to have more partnerships like the one MTN has brought to bear today. We have to commit ourselves to the cause, and that we fought a strong fight, a spirited fight since the start of this pandemic, and we cannot relent. While waiting for vaccines, we have to promote the use of public health measures and have and let the political leadership of the continent take courageous measures to blunt the spread of this pandemic while waiting for vaccines. I remain optimistic that as the continent, we will continue to be resilient and employ and commit ourselves to win this battle against COVID-19, at least blunt the spread of the third wave. Thank you again for the opportunity to join us on this platform, and we are counting on everybody to be a champion in promoting the wearing of mask campaign.
Thank you very much. That was Dr. John Nkengasong, the director of the Africa CDC, who was joined on this morning's briefing by Mr. Ralph Mopita. And Mr. Mopita is the Chief Executive Officer of the MTN Group. He was here to help Dr. John and the Africa CDC and the African Union launch the One More Push campaign. And that's really about using corporate assets through their social responsibility programs to support this very important work of fighting against the COVID-19 pandemic. So thank you very much both to Mr. Ralph Mopita of MTN Group and Dr. John Nkengasong, the director of the Africa CDC, for the briefings today. Thank you, colleagues, for joining us, and thank you for everyone behind the scenes. We meet again next week at the same time. Bye-bye for now.
Thank you. Bye-bye. And Ralph, good seeing you again.
Bye-bye.
Yeah, bye-bye.